Google, and we are back with another episode of the Forsyth Mags podcast. And today I have 3 very special guests. They are all from Novant Health, Orthopedics, and Sports Medicine. We have Dr. Stuart Saunders, a foot and ankle specialist. We have Laura, and we have Angela, and I'm going to let them all introduce themselves, but we're going to talk about some foot and ankle things today and what Novant Health, Orthopedics, and Sports Medicine offers, because I know it's a lot of stuff.
Yes.
What's up, guys?
Hey, how are you? Thanks for having us.
Yeah.
Yes, thanks.
So, Dr. Stewart, let's start with you. Tell us a little bit about how long you've been at Novant Health Ortho and what you do there.
So I've been there almost 8 years, and I focus on foot and ankle issues for patients aged anywhere from the teenage years up to elderly, I guess, weekend warriors, 70, 80-year-olds.
Weekend warriors.
That sort of thing. So just a wide variety of kind of different patient populations.
Okay. What's like the most common injury that you see?
I treat a lot of trauma, so a lot of ankle fractures, a lot of Achilles ruptures or injuries from pickleball or tennis or things of that nature.
Pickleball is intense right now. I bet there is a lot of injuries from that, actually.
Yeah, we have a partner who's getting over one right now.
No names.
Luckily not up. Yeah, no names.
No names. No surgery necessary.
Yeah.
Oof. So, Laura, tell us a little bit about you.
So I'm an athletic trainer. I also carry an additional credential that allows me to work in the operating room with Dr. Saunders. So my initial schooling is a lot of orthopedics background. Started out in the sports medicine world, working in a traditional setting of college athletics. Transitioned as I wanted to start a family and needed a little bit normal hours, so found myself with these guys. And Dr. Saunders and our clinic administrator at the time really helped advocate for me to be able to get into the operating room with him and learn that skill set to kind of grow my ability to help him and help our patients. It's done an awesome job in me being able to work with our patients and help them understand the process and answer questions and kind of help Dr. Saunders not have all the questions necessarily have to go to him if it's something I can witness and, be able to speak to. And obviously I've learned a lot from him from a skill set perspective. And so it's been really cool to be able to help our patients navigate that surgical process that is oftentimes intimidating, scary.
Oh gosh,
a lot of things.
So what does that look like when you two are working together in the OR? What do you do in the OR?
Well, he's in charge. He's leading the charge, but
What music do you listen to?
So it varies. It varies depending on the day, and who's in the mood and who's in the operating room. So there are some.
He has some limitations.
There's some good days and bad days in terms of music selection, but usually whatever keeps the OR room happy.
So
Metallica, Slayer, things like that.
Sometimes.
He's not opposed.
Yeah.
I guess most of your patients that you're doing surgery on, are they awake?
They're all asleep.
They're all asleep.
Oh. I was thinking foot and ankle. I don't know why I was thinking that. I know nothing about medical things.
No. So luckily they're all asleep. We don't do any.
Okay, so they don't get to have a preference on the music because they're asleep.
No.
How long is a typical surgery?
They can be anywhere from 30 minutes to up to 2 to 2.5 hours if we have to do a big reconstructive style case.
My dad had ankle replacement recently, and no one's never even heard of that before.
I was going to say, I never heard that.
He does those.
Yeah.
Yes, we try to do those in the right patients.
An ankle replacement?
So basically, it's like a knee. You're replacing the top and bottom of the joint with metal, and then you're putting heavy-duty plastic or polyethylene liners in there. And
That's intense.
They had to, because he had a screw in his foot from when he was 19 from a motorcycle accident, and they told him up front and said, we probably will have to take that out. Yeah. And he's like, okay, that's fine. They did not. They broke his heel, reset it, put 2 screws straight up the heel, which turns my stomach. Then his toes were different, so they had to flatten one out and put a plate over one, and but he's healed up and everything. He's walking, straight. Both feet are straight instead of, in an L the whole time.
Oh my goodness. That's crazy.
So yeah, we have a few patients like that come through that usually do pretty well.
Yeah.
So
And he's 76. 76.
So when I think of like it being sports medicine, I guess I just kind of assumed that it was mostly younger athletes that you guys work with, but it's the full.
yeah, it's a wide gamut
Okay.
type thing. So it all depends on the type of injury that you
Yeah.
have too. So
And as an athletic trainer, did you work with like schools, universities previously?
So
you said?
yeah, my previous 2 universities were Division I colleges. I was at
What
Wake.
sports?
Primarily field hockey and women's tennis. Most recently, prior to that, I've worked almost everything. It's
Okay.
just a matter of what my primary focus was. But,
Yeah.
but the last 6 years of my career, I was with field hockey. So
I bet there's lots of injuries in field hockey.
there was, yeah, and that's the cool part is the transition from that to orthopedics was a lot smoother than I actually realized. You know what I mean? I think
Yeah.
there was a lot of continuity that I didn't expect.
Yeah, that makes sense.
Though I had the confidence I would be able to transition. It was just a matter of learning the other side of the coin, if you will.
So, what is a message that you'd like to send out to athletes? Because obviously, some injuries are not preventable. They, accidents can't be helped. But I'm sure there's some that you're like, wow, this definitely could have been prevented if you would have done X. Anything come to mind?
Stretching.
I mean,
Stretching.
yeah, I was
Yeah,
gonna
definitely
say,
stretch.
taking care of yourself. You know what I mean? If something feels off, like don't brush it aside. Try
listen to
to.
the symptoms.
Your body's really good at communicating to you that something's going on. It may not be anything that needs urgent, you know what I mean, attention, but it may also be something you're like, okay, let me just keep this in the back of my mind as I continue to do what I enjoy or need to do, depending on your level of athletics. So yeah, it's just your body's a really good communicator, so pay attention to it.
Yeah. And stretching, like you said, before and after playing sports is probably a good idea.
Yes.
Yeah. So, did you guys play sports growing up?
I grew up playing soccer and baseball,
Okay.
but that stopped in high school. So my sister was the D1 athlete in the family. So
You're very tall for a soccer player. I feel like soccer players are.
Were you the goalkeeper?
I played midfield.
Oh, okay.
So
Lots of running.
lots of running.
I like
Yeah,
it.
so- yeah.
What about
Yeah.
you, Laura?
I was a swimmer.
Oh, very cool.
So
My mom, I joined a swim team when I was like in 2nd grade, I think, like our neighborhood swim team. I hated it so much, but my mom would not let me quit until I paid her back the entire fee that she had to pay for me to be a part of it. So I guess it was like supposed to be a lesson or something, but swimming is not for me.
yeah.
I like a lot of sports, but I'm not a good swimmer.
Well, I'm not an advocate for it now as a parent, though, because I'm not looking forward to any sort of swim meets in my future. But I know that's probably not preventable.
How many kids do you have?
I have 2.
So have they started sports
No,
yet?
no, they're still little.
Okay.
yeah.
Yeah, that's probably a tough one. Do you have kids?
3.
Are they in sports yet?
They are.
What sports?
The oldest is golf and tennis.
Ooh.
The middle is travel soccer. The youngest is gymnastics.
So all completely different.
They're all completely different.
So your weekends are busy, I would imagine.
I'm an Uber driver.
Yeah. Yeah.
That's your side
I would
hustle.
That's my
imagine
side hustle for my
so.
family
With
only.
no pay.
For my family only. Yeah.
No additional
The
pay.
tips are probably terrible.
You're a
The comments are interesting.
Bad
Yeah.
Uber.
Yes, exactly.
Duber.
That's so
funny.
interesting that none of them picks the same sports.
No.
Yeah. That's awesome though. I like the diversity. Did you have any because I'm not a parent yet. Like, do you have any sort of say, or you kind of let them choose? How does that work?
We kind of let them choose, and they kind of naturally will fall into what they enjoy doing
And what they're good at.
and what they're good at.
Yeah.
So we definitely went through lots of different sports with the oldest, especially with baseball. It just didn't work. Basketball didn't work. So just got to let them kind of find what works best for them.
There you go.
Yeah.
And is there any sports that you would be like, no, please don't do that one with being what you do?
No, my wife's adamantly opposed to football, so we're definitely not going to be a football family.
Yeah.
But
I guess that's stereotypically the most common injury. Is that true? Football being the highest injury rate.
it can be depending on what injuries you're looking at in terms of
Yeah.
just the kids hitting each other early on isn't ideal.
I'd say it's more about age and development
Yeah.
than it is about the sport.
Yeah.
Because any kid doing something they're not developmentally ready for is where things start to get hairy. And then specialization at a young age.
Okay.
So, like, not that you can't pick a favorite sport, but, like, allowing them to still participate in other things.
To try to avoid overuse injuries.
I'll encourage muscle balance as they grow.
Yeah.
Instead of isolating baseball gets a bad rap, but like if you pick baseball early, you know what I mean? If they're only throwing with one side of their body, you know what I mean? Not engaging the musculature and stuff on the other side, it can, affect
that
growth
makes
and development and
sense.
stuff.
So my question with that is, if you're not in the field that you're in, how hard is that to do? I mean, because you say, well, you need to make sure that you're doing it, but
I feel like
Do
if you picked a sport like gymnastics, that's like in my opinion, a very well-rounded.
Or swimming.
Or swimming. Okay, swimming. Yeah.
Yeah, I don't know that it's necessarily hard as much as it's intentional. I mean, I think our world is now like, you as a parent, like, you want your kid to be the next NFL athlete. You know what I mean? So like
that drives me nuts.
If they're good at something, you
Yeah.
know what I mean? And then they start liking football, the temptation is to be, okay, they can keep playing football. They can do this football in the spring. They can do this football in the fall. You know what I mean? That kind of thing. Whereas intentionally saying, okay, no, football season's the fall. And then trying to say, you want to play basketball during the winter? Do you want to do track during the spring? Whatever it is, as they continue to grow, because it's really about baseline fitness.
Yeah.
Especially for most young athletes.
So I think my question was more getting them to actually do the fitness aspects. Do you have your kids that are in sports, are you adamant about they do all these correct things?
Yeah, I am, or we are in our household. So we make him, even though our travel soccer, he plays soccer year round, he still has to participate in other sports. He's involved in a running club for his fitness. So we make sure that he's not just isolating in on that one thing.
Yeah.
Same thing with our oldest. He's a little bit easier because he likes everything. So it's a little bit easier for him. Our youngest, she's the one who's only wants to do one thing, but she's still young, so we're not too worried about her.
She's the one doing gymnastics?
Yeah.
Well, I think that's a well-rounded sport. I'm a CrossFitter, so I think I am envious of kids who started gymnastics young because that's going to set them up well if they stick with it. Although I feel like there's also the part of going gymnastics, the high-level gymnastics has a very scary injury possibilities too, so I don't know. You can get hurt doing anything though.
Sure.
True.
Yeah, absolutely.
Yeah. So Angela, I know you're here for moral support.
Yes.
But tell us a little bit about you and what you do.
Sure. So I'm Angela. I'm the clinic administrator for the practice. So we actually have several other surgeons in our group in the Clemens office, in addition to Dr. Saunders. But essentially my role is to support them and make sure that they can take good care of patients and hopefully provide them with whatever resources they need, get rid of barriers, and just make sure that they can do their jobs well. So out of our Clemens practice, we have Dr. Saunders doing all of our foot and ankle cases and seeing all those patients. We also have total joint replacement, sports medicine injuries like to your knees and hips, hand surgeon on site. So a lot of variety there with the different services that we offer right there in the Clemens practice. And then we have an office in Winston-Salem that we work out of. So Dr. Saunders is also at our Robin Hood location 1 day a week for a half day, where we also at that practice see we have another hand surgeon on site there. So lots of variety and diversity in the types of patients. We see our walk-in patients out of the Robin Hood office Monday through Friday, 8 a.m. to 7 p.m. So we're just constantly seeing patients move in and getting people scheduled for surgeries when they're needed. And I thought it was kind of funny. You can get hurt doing anything. So my husband recently stepped out of our fishing boat wrong and messed up his Achilles tendon, and he had to come see Dr. Saunders. Luckily, he didn't need surgery, but they took great care of him and provided him all the exercises he needed and all the over-the-counter treatment and the boot to walk in, and he's now doing a lot better. So you
That's
literally
good.
can get hurt doing anything.
Especially the older you get. It's like, I slept wrong last night. And
Yeah.
I'm like, really?
Yeah.
And it's not just the acute stuff. Like, he manages a lot of chronic, you know what I mean, pain and symptoms of things that people have been dealing with forever. Kind of like what we mentioned earlier of, like, there was a previous injury and now it's been 30 years. You know what I mean?
Yeah.
Do you see a lot of runners? I don't know if we.
I have recently.
Yeah.
So there seems to be like a little running club that's
Good
come
reason
by,
not to
that's-
run. I don't
that's come
know.
by
I know. That's what I'm thinking.
and seen me for a couple different issues, but
There's an inside track on that one.
Yeah.
yeah.
I love that you mentioned that your husband, he didn't need surgery, so they helped him with like exercises and stuff. I'm sure you would agree, surgery is always a last option. If you can do it, if you can fix it with different exercises and different things, then surgery is not always necessary. Is that right?
Right. We try to, and I especially try to provide my patients with multiple options, both operative and non-operative, always giving them the choice, especially so that they can make the best decision for them moving forwards.
Yeah.
With
So
it.
that is something that you guys offer. Like if you come in and
You're not
gonna-
absolutely going to be signed up for surgery.
Okay.
So-
Good to know.
But if you need to, we will.
Yeah.
But
Yeah.
Most of what he does is technically elective, though there may be strong reason to do one thing or another.
Yeah.
so
Yeah, that's probably tricky to make that call sometimes as a patient. I'm sure that the recovery times, I feel like with current medicine, is probably way less than it was in years past.
yeah, they definitely vary now, and we've gotten a lot better and doing smaller incisions and things like that to kind of speed up the recovery time. But
Yeah.
for me, for ankle fractures, I'm allowed, at this point, I let a lot of them walk at 2 weeks, whereas before you couldn't let patients walk for 2 to 3 months type thing with, being in better fixation and things of that nature. So there's different things that have definitely gotten better that help to speed up the recovery process.
Yeah, 2 to 3 months I would be depressed by that point. That would be really hard
Yeah.
to handle. Well, okay, we have a few more minutes. Anything that you guys want to chat about that we have not chatted about yet? About things, misconceptions, how to get in touch with you guys, how to find you. So you said you have walk-ins.
Yeah, so we definitely have our walk-in option on our at our clinic on Robin Hood Road.
Okay.
Really easy to schedule with us. Go on our website, and you can,
What's your website?
NovantHealth.org, and there's a provider finder option, so you can plug in the specialty or the provider name that you're looking for and schedule online.
Okay.
Calling our office is super easy. Getting in touch with one of our team members will get you scheduled. If you're already a Novant Health team member, you have My Chart. You can also see your primary care doctor if you need a referral. Referrals aren't required, but
that was my next question.
yeah, unless your insurance requires it. But our clinic does not require a referral to see
Okay.
Dr. Saunders, so you can easily get a referral or just contact the office either online or by calling to schedule. And Dr. Saunders is available in Winston on Tuesday mornings and in Clemens the rest of the week when he's not in the OR. I guess we could add like where you do surgery locally, right? It's right there in Clemens as well. So
Okay.
I don't know if you want to, maybe it'd be interesting to kind of share where you operate and kind of what the difference is, because you go to 2 different operating rooms, right?
Yeah, so we operate at a outpatient surgical center 1 day a week, and so that's right above our office, so easy to get to. And then also operate at Clemens Medical Center, which is our joints hospital, but they also allow for outpatient surgeries too.
Okay.
And so in terms of convenience, usually both are very convenient. Great, both have great nursing staffs, things of that nature. In terms of for any inpatients type settings too, I haven't heard of any complaints about Clemens Medical Center from an inpatient, or if you have to stay for observation. Everyone seems to really like that hospital from that aspect of it.
So
and it's
that's-
not that far away. It's
That's
really,
where my dad had his ankle replacement.
Yeah.
And then he had some, is it TIAs? Is that what they're called? The little mini stroke things. He went all the way back to Clemens because he liked that hospital.
Right.
To have that checked to the emergency room. And he loves that. We live nowhere near Clemens. And
it is a good medical center. I've been there.
Yeah.
And he goes all the way back out there.
That's
A,
probably
it's
my
not
first
busy,
choice.
and B, it's friendlier.
Yeah.
Yeah, that's true. My grandfather, who has now passed away, he was having a heart attack, and we drove him there because we didn't know he was having a heart attack. We thought he might be. We drove him there. They got him in immediately, and we're like, "Yep, you're having a heart attack. We need to send you here." But I always wonder, like, if we would have gone directly to the ER, like, I don't know if he would have got seen that quickly. So definitely a good spot in Clemens.
It is.
So these are your guys if you step out of your fishing boat wrong,
Yep.
or if you have a pickleball accident,
Absolutely.
or if you're playing tennis, or if you're running,
CrossFit.
or CrossFitting. There's no injuries in CrossFit.
And Stuart Saunders was my dad's surgeon.
Wow.
Oh my
Okay.
gosh, you asked him?
It
Very
just,
cool.
Yeah, my mom just told me.
Wow.
Oh, that's hilarious.
Awesome.
Yeah.
Small world. Small world.
Yeah.
So if the name means anything,
Yes.
that's
Okay.
yeah.
Small little town we live in.
Yes, it is.
It is a small world.
Well, thank you for coming to chat with us today.
Yes,
Yeah, thanks
for
so much for having us.
Yeah, anytime. We'll have on some of the other doctors next time.
Yes, absolutely.
How many do you have again? Remind me.
So we have 10 surgeons and 1 sports medicine, family medicine doctor who
Okay.
doesn't go to the OR. So a nice blend of
Big practice.
providers, and then quite a few physician's assistants on board with us that partner with our surgeons as well.
Awesome.
So
Well, as always, you can find Forsyth Mags online at forsythmags.com. You can find all of our content, and you can find all of our social media at Forsyth Mags on Facebook and on Instagram. And that is a wrap for today. The views and opinions stated on this podcast are solely those of the contributors and not necessarily those of our distributors or hosting companies. This podcast is copyrighted and cannot be reproduced without expressed written consent of Forsyth Magazines Incorporated. Ooh, that's a mouthful.